So Chalazion is probably the most common thing I see in the office on a daily basis, and what a Chalazion is a clogged oil gland in a patient's eyelid. They are basically modified sebaceous sweat glands, and they have very large pores on the edge of the eyelid, which sometimes become obstructed. And what can happen if you get an obstruction is that the gland will continue to make oil. It will not be able to force it out of the blocked opening, and the gland will continue to make that oil to the point where it becomes very, very, very engorged and then starts to leak that oil into the surrounding tissue. The leakage yields a fairly strong inflammatory reaction in most patients. In fact, bad enough that it could look like they're infected. The lid will get quite swollen and red. What Chalazion treatment involves, typically there are some medications that are successful, but generally about 50% of the time in my experience, and maybe not even that much for some of the larger lesions. And then very often they have to be excised in the office, which is usually the way to do Chalazion surgery. We typically excise them in the office with local anesthetic. And for most adults, that's a very tolerable way to do it. It's about a 10 to 15 minute procedure in office. It's a satisfying procedure to do in that patients are nearly always happy with the result and always very happy to get rid of what is a very, very unsightly blemish in their eyelid.